And you've chosen to use the Restylane Kiss today, right?
I have.
Why?
I just wanted to try a different product, see how it feels.
Okay.
And I've heard, it is possibly a little more smoother, more natural feeling.
Okay.
So that's why I chose it.
So basically, Imran has had filler done in the past and was very happy with it, but we've decided to go with this newer filler by Restylane. It's called Kiss, and see if it's something that he feels that is a little more maybe natural or smoother in his lips. So that's what we're going to use today. So as you can see, we've got our box and we've got our syringe. Imran has been numbed up with topical numbing, so he's nice and comfortable. But then again, this first couple of injections might be a little
poke.
So here we go. We're going to start right
gosh.
down here. You set? Okay, my friend. We've already cleaned everything off with alcohol and so forth, so we're good to go. Here we go. 1, 2, 3. Ay, ay, ay. You okay? Good. All right, so we're going to kind of just see how. It's got a great flow to it. How you doing?
I'm good.
1, 2, 3. We're trying to add a bit of volume right in this central area of his lower lip. So that's why I'm basically going right in that area and staying in that one spot. And then basically just feeling and smoothing a bit as I go. I like that. Just a tiny bit more in there. 1, 2, 3. There we go. Just to kind of give him a little bit of a more rounded fullness in that central portion. And actually, I think we're achieving that quite nicely. We're also going to do a bit on the upper lip as well, just to give him a little bit more volume, a little rounded edge right here, and just to define his vermilion border a tiny bit more. You okay? Awesome. Looks good. It also does, it feels nice and smooth. Okay, and just getting that bit of central volume in there. Open your mouth. Okay, close your mouth. Okay, good. It's already starting to swell up, so of course it's going to start looking a little bit bigger now than it's going to be in the end, but I like what I'm seeing. Okay, you ready? All right, we're going to go toward the vermilion border of the upper lip. Here we go. 1, 2, 3. Oh, you're awesome. You okay? It's got to be a little bit of a stick there, I'm sure.
It's always the upper lip that's more sensitive.
I think you're exactly right. Okay, we're going to put, not only are we going to kind of outline this area and define the vermilion a bit, but again, we're going to add just a tiny bit of a volume to it as well. I'm sorry. Here we go. 1, 2, 3. You can see a little tiny tear in your eye. So it's not completely without a little annoyance. Okay, I like that. I'm going to go to the other side, and then I'm going to give you the mirror because I want to get your opinion and make sure this is exactly the volume that you're looking for. Again, it's swelling, so it's going to look a little bit different. But we don't want to overdo it. We just want to give him a nice volume correction that's perfect for his face. He's got a great mouth as it is. He's got a great size. The vermilion border's nice. And the upper and lower lips are nice and even. So he's already got great anatomy. So we're just kind of adding to that just to give him a little bit of the volume. He doesn't really need any corrective filler at all for the most. And of course, the lips are so incredibly vascular, we can expect them to bleed a tiny bit and probably bruise as well. So basically, if we have our patients avoid taking things like aspirin, vitamin E, fish oil supplements, and alcohol, maybe about 5 days beforehand, we can reduce the chances of a lot of inflammation, but at the same time, we are still going to get some bleeding and possibly some bruising. So we always want to let them know that as well. And now that I'm over on the right side of his face, I'm just going to kind of add just a tiny bit more volume where I know that he wants to see a little bit more of a silhouette with a more rounder lip.